Okay, thank you for joining us today, and sorry for the technical delay. Today we have Dr. Sara Nasser joining us from Italy, and also she works in Berlin. She will be giving us a talk about artificial intelligence in gynecological oncology, a very interesting topic indeed. Thank you, Dr. Sara, for joining us, and the floor is yours.
Thank you very much, Dr. Hisham, for the invitation. It's lovely to see everybody. Shukran al introduction. Wassalamu alaikum. I'm very happy and delighted to be speaking about this very interesting and actually quite new topic in gyne oncology. It's becoming more important and more relevant in the last few years in our field, and it's redefining what precision medicine means, what prediction means, and how patient care evolves. So, as you rightly said, Dr. Hisham, I'm Sara Nasser. I'm a gynecological oncologist. I currently work at the Gemelli Institute in Rome, and I'm affiliated with the Charité Hospital in Berlin and the VP of the Pan-Arabian Research Society for Gyne Oncology. So why is it important now to talk about artificial intelligence, especially in gyne oncology? So I don't need to tell this audience that cancer is a global burden, especially gynecological cancers, looking at rising incidence in cervical cancer, endometrial cancer, and ovarian cancer. However, patients with these cancers are also surviving longer due to the developing technologies. However, there are still inequities and inequalities in the access to cancer care, especially diagnostics and treatment. Artificial intelligence in this aspect is a force multiplier to increase precision, to increase scale and speed for diagnostics and treatments. So the tools are already here, and the revolution starts when we choose to use them. What do I mean by this? So actually, artificial intelligence is not as young as we think. Artificial intelligence was born in 1955, which is actually probably a bit older than some of the people here in this group. The first person to actually talk about artificial intelligence was Alan Turing in 1950, because he proposed a test for machine intelligence. So he basically said that if a machine can trick humans into thinking it is human, then it has intelligence. And this is how he defined artificial intelligence at the time. I'm not going to go through all of this timeline, but as you can see, artificial intelligence was developed starting from the 50s. And then we started investing in artificial intelligence between the 50s and the 70s, starting to build machine learning models. So machine learning models meant that this artificial intelligence was able to summarize data, able to save data and process data. But it was not really able to learn. The first artificial intelligence that started to learn, and that means that we developed neural networks, that's what we call, and this is what you hear now being called deep learning, was in the 90s. So between the 70s and the 90s, not much happened within the development of artificial intelligence. And that's what they call, and you see it here in the timeline, artificial intelligence winter. There wasn't really much development, there wasn't much funding going into artificial intelligence, and so there was a big pause in those 20 years. And then in the 90s, started again developing artificial intelligence, and scientists discovered this neural network deep learning model. What was the difference between machine learning and deep learning was the fact that deep learning algorithms were able to actually not just store and process information, but to learn from previously stored and processed information. So this is what made it closer to human intelligence. And that was in 1997, the Deep Blue computer, which was a chess-playing computer from IBM. Actually, some of you may remember this. I remember this, actually. And then from there, the development of artificial intelligence began. In 2011, we had Siri. Siri was born. And in 2014, Alexa was born. And so we continue to increase the precision and the learning ability of these deep learning algorithms. So how are we using artificial intelligence in gyne oncology nowadays? So artificial intelligence, and it would be interesting to hear the experience of the people involved and listening today with artificial intelligence in their day-to-day clinical practice. I'm sure some of you have already had some contact with artificial intelligence, for example, ChatGPT models, where you're asking questions and you're getting information. And so this is one type of artificial intelligence, deep learning model of artificial intelligence. We're actually using artificial intelligence in our day-to-day practice more than we think we are. A lot of gyne oncologists view artificial intelligence maybe as a competition. However, my view is that artificial intelligence is not a competition, it's an adjunct to increase the speed, increase the scale, and increase the precision of what we actually do. And most importantly, especially with the work personally I do, is we can increase the outreach to centers, to networks and collaborations where we would normally not be able to actually do this or do this with a lot of difficulty. So these are the areas where artificial intelligence is currently being either used or researched. And you can see it's a whole spectrum, starting from screening and early detection, diagnosis, treatment planning, surgery, and follow-up. And I'm just going to go through these areas. And I'm happy to hear afterwards, maybe in the discussion part, of any kind of examples that you may have seen or you may have heard of. So starting with artificial intelligence in screening and early detection. We're talking about all gynecological cancers, specifically cervical cancer and ovarian cancer here. And this is just an overview of the traditional screening and early detection methods that we normally use in these cancers. So for example, in cervical cancer, colposcopy and the pap smear. In ovarian cancer, transvaginal ultrasound. There's no official screening for ovarian cancer, but biomarkers, transvaginal ultrasound, and other imaging tests. So how is AI currently being used? So for example, AI is being used as a deep learning algorithm for automated pap smear interpretation. What does that mean? It means that, and I will go here, there's publications on this. I'm happy to share links afterwards in the group if you would like to have a link to the articles. It means that there's AI deep learning models that can actually analyze samples from pap smear tests and increase the accuracy and precision of screening and diagnosis. And this has been published in several articles recently in the last 2 to 3 years. It isn't being rolled out worldwide because obviously having these deep learning algorithms does come with a cost. But for example, at the institution I work in now, this is something that we use on as an adjunct to help with pap smear analysis. There's also projects undergoing with deep learning in ultrasound and MRI for cervical cancer and for ovarian masses. So this is a project that we're doing at the institution I currently work in, where we're analyzing remote ultrasound images for ovarian masses to increase the precision of and detection of malignant ovarian masses versus benign ovarian masses. And this seems to have, although the results are not published yet, but this seems to have quite a high accuracy and can be used as a good adjunct to help clinicians and to help train clinicians, as well as to aid with remote training and access to remote clinics, for example. So this is where it plays into risk prediction models and biomarker analysis. So these are all algorithms that are based on deep learning, which is artificial intelligence that can process a large number of data and then come up with a risk prediction model, which, if a human were to do this, would take much longer, much more data analysis, much more time consuming, and much more effort. In addition, the artificial intelligence algorithm would be able to see minute details that possibly a human would not be able to identify. And so this is an article on the role of artificial intelligence applied to ultrasound and gyne oncology. It's a systematic review done by the team at the Gemelli Institution on exactly these deep learning algorithms for ovarian masses using the IOTA criteria and classifying ovarian masses as benign versus malignant with a higher accuracy than the human eye. In addition, when we're looking at artificial intelligence in screening and early detection, for example, in breast health, there is a product called Cellbria. It's a thermal sensor that you apply to the breasts that can detect possible breast tumors and breast formation. This is connected to a deep learning algorithm in the form of an app that the patient then downloads, and it gives a risk model of how likely it is that this combination is actually suspicious, borderline, or benign. And this is something that's being sold right now in South America, has a sensitivity and specificity very close to mammography, so could be used as a pre-screening for a mammogram or even possibly in the future replace a mammogram. Similarly, another AI algorithm in screening and early detection for breast cancer is VARA. VARA is also an AI-based model. It's a deep learning model that helps radiologists analyze mammography pictures. So instead of a radiologist looking at the mammogram, which again increases the component of human error, you have a VARA software and the VARA platform that can actually pick up on details much quicker with more precision and pick up on minute details that possibly the human eye would not be able to see. Second would be AI in diagnostics. So AI in diagnostics is actually being used in centers in Berlin as well as in Rome that I can talk about for pathology and genomics. So digital pathology, it's being used to analyze histopathology blocks, to look at molecular subtyping, especially for endometrial cancers. There is also research on deep learning algorithm for proteomics. So, for example, looking at embryo selection for in vitro fertilization and looking at which embryos are actually most likely to successfully implant. So these are technologies that are being developed. And the fourth one is manual versus AI-enhanced histopathology comparison. So actually looking at AI enhancement, again, improving on the human error part. So this is how, for example, this would work. So you have the tissue, you have the normal molecular testing with the slide scanning, and then you have the digital imaging. The AI analyzes the images and then input data into a database, or you can even use the data for telepathology. In terms of treatment and decision-making, AI is also being used in, or can be used. I'm not aware of AI being used in tumor boards unless you're actually basing your tumor boards on digital pathology, which uses AI algorithms. Similarly, you could be using AI algorithms to analyze MRI and CT images from afar. And you can be using AI algorithms to analyze colposcopy pictures, for example, and hence either increase the accuracy of diagnosis or even replace or aid a nurse, for example, a nurse practitioner in a rural area or a rural clinic in actually diagnosing, for example, major changes on a colposcopy picture. A lot of research is being done on artificial intelligence algorithms to use to make personalized treatment plans. So, for example, in the area of prehabilitation in gynecological oncology, AI algorithms can interpret a lot of the preoperative and perioperative data for patients and come up with a personalized treatment plan. For example, also predictive modeling for chemo response, the Killing score, which is also based on an AI algorithm, looking at response to neoadjuvant therapy and how likely it is that secondary cytoreductive surgery would be successful in certain patients. So these are areas where, for example, artificial intelligence algorithms can actually be used in order to increase accuracy and increase prediction in treatment decision making. In surgery, this is a very interesting area. You may have heard of AI-integrated laparoscopy and robotic platforms. In my institution, we're actually using a real-time intraoperative analytic AI, especially for detection of sentinel lymph nodes. So currently, we're at the learning stage, and I will talk about that in the consideration slides, but we're developing an artificial intelligence model that will aid the human eye in detecting sentinel lymph node pathways and hence the sentinel lymph nodes by analyzing in real time intraoperatively the images. And this is really the new era. So AI can analyze a lot of text, can analyze a lot of data, and now the next step is to learn how to analyze videos and images. And this is where we're at this point in time in the development of AI, and particularly AI in surgery, because the idea is to be able to use AI algorithms to, for example, identify certain areas or certain anatomical structures during the surgical procedure and, for example, warn the surgeon that there may be an abnormal vessel here or an abnormal structure which they need to avoid, or that there is, for example, like I said, sentinel lymph node procedures. So when sometimes it's difficult to detect, AI could help in being more accurate in detection. Based on that, it can also be used as skill training with virtual reality and AI feedback for students and for trainees, and hence promotes accessibility and inclusion in surgical care. So this is, for example, this is also from an article, which I'm also happy to share with you, on how AI in surgery is being taught. So a lot of the projects that are ongoing at the moment are in the stage of the artificial intelligence needs to learn these procedures. So there is a lot of input involved. So for example, you have a laparoscopic video here. This is a laparoscopic video of a gallbladder, and the AI needs to learn the instrument detection. So you can see here, it recognizes that's a cautery hook. Then it recognizes the anatomy, so the liver, the gallbladder, the cystic duct, the common hepatic duct, and then it also recognizes the action that's being done, so the hooking. And this is the stage where artificial intelligence is currently at in learning how to analyze and process images and videos. And the idea is that it can be used as a real-time intraoperative adjunct and software in order to aid the surgeon during the operations. In follow-up and survivorship, this is probably the area where artificial intelligence is being used most in the form of either wearables, for example, watches, etc., for symptom tracking, but also chatbots for follow-up and support for patients, and predictive alerts for recurrence and complications, hence empowering women, especially in underserved regions. And this is where there's a lot of applications using AI algorithm, whether it's machine learning or deep learning, in order to keep accompanying patients in their follow-up and their survivorship journey. Another project that AI can actually assist with and where it's a bit easier to be used is administrative tasks. So for example, there's a group in London that's developed an artificial intelligence program. They're gyne oncologists for dictation. So dictation tasks, for example, the idea is instead of the surgeon dictating their surgical report following the procedure, the AI will be watching the procedure and can already compile the surgical report as the surgeon is operating, so that the surgeon at the end would just actually look at it, correct anything, and it's already been transcribed during the surgery. The same with a patient consultation. So the artificial intelligence would be listening to a patient consultation, and the doctor doesn't need to actually write anything. The AI will transcribe the consultation, and then the doctor just needs to confirm that everything is correct. So there's obviously issues with that, but these are the areas where artificial intelligence is being developed to actually make clinical activities, day-to-day clinical activities, quicker, more efficient, so that the physicians and the surgeons can actually focus on their tasks. This can also be applied to electronic logbooks. So for example, a surgeon does a procedure. This procedure will be logged automatically into their logbook. They do not need to actually do that manually. Similarly for discharge documents, and where it's actually being used for the last few years as appointment systems and warning scores, so looking at blood pressure, vital parameters, and actually indicating that there's a risk. So considerations, I've spoken about a couple of considerations, mainly data privacy, which is always an issue with artificial intelligence because it's new. There's regulatory and legal implications, so we don't know how much data privacy actually exists. Obviously, if we're starting to use artificial intelligence within patient consultations, what's the data privacy status like? How do we ensure that data privacy is protected? And data input. So data input is actually a very big thing because artificial intelligence needs to learn. So before you can actually use it effectively, and maybe you have seen this also with ChatGPT, initially it is actually very bad. And they need to learn. They need thousands and thousands of pictures of colposcopic images, and they need input from the physicians on the different, for example, changes, major changes, minor changes, before the AI itself can be used. So there is a learning curve for the artificial intelligence, and that learning curve needs a big set of data in day-to-day activity. Ethical considerations, obviously tied to data privacy, and representational bias. So artificial intelligence will only learn what we teach it. So we need to ensure that there is representation of all groups and that there is no bias in the data that's being put into the artificial intelligence. So it's important to look at inclusive data sets and ethical frameworks. However, I think investing in artificial intelligence, especially when it comes to gyne oncology, either day-to-day practice, whether it's screening, detection, whether it's treatment or follow-up or surgical, is worthwhile, especially because of the component of higher outreach, higher precision, and being an adjunct to the surgeons or the physicians' work. But it's also important to train the physicians and the clinicians and to build an alliance with the artificial intelligence engineers. So we need to be speaking the same language as the engineers, and we need to be working very closely to the engineers that actually put in the data into the artificial intelligence. But ultimately, artificial intelligence is an empowerment tool and not an exclusion tool if we decide to make it so. And a last comment or remark, which unfortunately I haven't added into the slide, is that there is a, I think, very useful conference happening on the 9th and the 10th of June in Houston, Texas, if you're around. It's hosted by Dr. Pedro Ramirez, a gynecological oncologist from the area, and it focuses on artificial intelligence and its application, not just on surgery, but also on research in gynecological oncology. You can participate online, and obviously you can also attend. And I will forward the link to Dr. Hisham so he can share it in the group. Thank you very much, and I look forward to your questions.
Thank you, Dr. Sara, for this wonderful talk. Interesting new topic. But my question is, do you forget about what's out there? Do you use any artificial intelligence in your practice?
Thank you for the question, Dr. Hisham. So yes, I personally do in the form of, for example, ChatGPT for summaries and for research. So these are the two areas, and obviously everything else that I mentioned are ongoing study projects. So these are not projects that we're actually using. We're using them within the form of a study and a research project, which is very different. But using artificial intelligence to summarize big studies, to summarize research, is something that I do on a day-to-day basis. I have to say, though, one has to be very careful still because AI can still make errors.
Yeah, exactly. My experience with ChatGPT is that it's really nice, but don't use it in when I tried to use it in medical, the results were disappointing. So
yeah, I
just use it
totally
for
agree.
life.
Yeah, I totally agree. There is a beta version that will be coming out, which is really looking at medical research. Again, it will be interesting to see, but this is what I was saying, you know, I don't think artificial intelligence is here to replace our own critical thinking,
To
but
augment.
it can make it easier for us. Instead of me spending an hour searching for various articles, I could be helped and I could have certain articles. However, it does not replace my critical thinking. And one has to be
Yes.
very careful with that.
Okay. Any questions, please? If you have a question, raise your hand. We start with Dr. Medhat Khafaga. Please, if you have a question, raise your hand. Dr. Medhat, unmute.
Okay, okay. Thank you, Dr. Nasser. You have an Egyptian
Yeah,
name, huh? Okay.
Lebanese.
She's Lebanese.
Lebanese, very good.
Lebanese, yes.
A few questions for you.
Please.
At first, when doing research, we have a problem, two problems in research. At first, we want to be sure that the research which I'm going to do was not done before. That will help, the AI will help in that. That's one question. The other problem is to bring the references, which from it we are going to write the paper. Reference from all over the world, from India to China to everything, to Australia, to United States, to get the references which I need to know about the research which I am doing or going to be done. That's the second question. Third question, can AI predict the patients whom is going to recur so that I will avoid operating on them or treating them?
Okay, so I will start with the question of the reference, if that's okay, Dr. Midhat. In terms of references for research papers, actually, AI algorithms are quite well developed. If you use something like ChatGPT, it doesn't have to be ChatGPT, it can be another AI, but I'm most experienced with ChatGPT. There is the option of doing deep research. And then if you do that, it can actually replace the program of EndNote. So it can give you references to articles. And I found that personally to be very accurate and to be a time saving, a lot of time saving. So it can actually look at sentences.
Can you send the link to do that?
Yes,
Give
of
it to
course. I can
Hisham?
send it. I can send. Yes, of
To
course.
Hisham. The link
Dr.
to do
Hisham, I will
that.
send it to you.
Yes,
Yes,
send me
it's
the link.
very
I'll send it to
helpful and
Dr.
very
Medhat.
quick. It is
Okay.
very helpful and very quick. So this was for the reference. In terms of your question of can AI predict recurrences? So this is what we really wanted to do. There are some scores, for example, the Kalim score, which uses, it's an artificial intelligence algorithm, which uses certain markers. So biomarkers, CA125, for example, in ovarian cancer, previous cytoreductive outcomes, then some blood markers, etc. And it calculates how well a patient has responded to neoadjuvant chemotherapy and how well they would do having a secondary cytoreductive surgery. However, we don't have a definitive algorithm yet. But as far as I know, there is research ongoing to see whether AI can help predict recurrence, whether it's in ovarian cancer or whether it's in other cancers. But we're not there yet that there is a specific artificial intelligence that can do that now. But these would be the areas where people are looking into.
It
And
is something like a nomogram. Nomogram.
Yes,
You know
for
that there
example,
is
yes.
a nomogram is a part of that, but it
Yes.
just tell you the percentage of recurrence, the 5-year survival in your patient, and that's all. But it's not yet ripe enough to use it, right?
Exactly, it is not. The ideal would be that for each patient, depending on their genetic risk factors, depending on their genetic composition, the DNA, the blood samples, etc., we would be able to have a personalized recurrence risk plan, and also any other risk factors that we could optimize in the follow-up period so that we can reduce the recurrence risk. But we're not there yet.
How about predicting what tumors will occur in one person after doing the genetic profile of this person?
Yes, absolutely.
Can we
So
do that?
yes, there are some
Predict
biomarkers.
which tumors you are liable to.
Exactly. So there are some AI algorithms that can detect through proteomics some biomarkers in a sample test of either saliva or blood. You may have heard of GRAIL. GRAIL looks at biomarkers for pancreatic cancer, colon cancer, and even ovarian cancer. I don't think breast cancer is in there. However, again, very experimental, not tried in large trials. I know they're very popular in the States because they're being sold, but in Europe, they're not allowed because they're just very experimental. We don't have enough data to see actually how accurate this is. But they look at proteomics and they look at metabolomics, and they use an AI algorithm to predict how likely it is that this person is going to develop pancreatic cancer based on a blood sample test. It's called GRAIL.
I'm sorry, it is based on circulating tumor DNA. There is one which is on the market in the United States, is $900, which predicts, which diagnose if you have one of the pancreas or otherwise, but depends on tumor DNA in the blood sample, circulating
and
tumor DNA.
so this is the GRAIL. I think you're talking about GRAIL. It's called
Yeah.
GRAIL, I think. Yes.
Yeah.
Yes, it is based on that, but they use artificial intelligence to analyze that. So it's the algorithm that they use is based on artificial intelligence.
Thank you.
Okay, Dr. Sami, wait. I have a question from
Dr. Sami, I think.
Please introduce yourself and go ahead.
Good evening. Assalamu alaikum.
Hello.
Sami Ismail, Gyne oncologist in Bahrain. Okay. Good evening, Sara. A very interesting presentation as usual, from your side. Just I will say some comment or considerate questions. It is, what is the side effect our default will see from using the artificial intelligence? I will tell you my question and you can answer it. And what is the responsibility of artificial intelligence in medical legal field if we are depending on it completely? That is the second question. Third question, we still in the era of Mr. Google. So we are coming now with Mr. Artificial Intelligence. That is, it will be in the hand of everyone, especially the patient. That is, the patient are going and coming with artificial intelligence and giving you what is the treatment and what you have to do. And this is debate is always, how we are overcome this point.
Dr. Sami, thank you so much for this very, very interesting question. And thank you for joining as well. Salamat back to Bahrain. So I think you just made a very, very important point, and this is the main point of discussion with the development of artificial intelligence, because it is yet not regulated, or the regulations around it are being developed. Definitely in Europe, they're being developed, but they're not as fast, and we don't know the implications that this is going to have, because as you said, a lot of these artificial intelligence algorithms are in the hands of everybody. And like I said, artificial intelligence can only learn what we teach it. So depending on what you put in, That's the output that you get. I do agree with you that this will have implications. For example, people are starting to use ChatGPT as therapists.
Yeah.
So instead of going to therapy or to psychological therapy, they write to ChatGPT, and then the information that ChatGPT, this is something that's not regulated, because how do you know what's being put into this algorithm, and how do you know what happens with the information that you put it in? And also with patients, patients are, like you said, we're in the era of Mr. Google, but I think the younger generation are starting to use ChatGPT instead of Google. And so, it's as if ChatGPT is maybe their doctor. I had a friend of mine who put in all their symptoms in there, and then, the ChatGPT would just kind of tell her what to do and the diagnosis, etc. So I think it is even a step further than Google, in the sense of how do you control what ChatGPT actually tells you in terms of medical advice to patients. And I absolutely agree with you. I don't think I have a clear answer in the sense of how do we overcome it, apart from the fact that this needs to be monitored and needs to be regulated.
And what about the medical legal point? If we can, I say that it depends on if something happened. I went with artificial intelligence and complication that happened. He's my partner also. He can carry the medical legals problems, or he's innocent.
Absolutely.
He will be innocent.
Yeah, absolutely. 100% agree with you. I'm pretty sure there will be some cases in the States probably soon with regards to this. I'm not aware of any ongoing cases currently legally, because I had a conversation with colleagues about this a few weeks ago. Currently legally, ChatGPT, artificial intelligence, is not a legal entity. So therefore, there is no kind of legal blame. So if you said, I asked ChatGPT said do this, and then something happened and there was a complication, there is no legal background. However, I do expect
your
that this will
responsibility.
become a problem. It's your responsibility. However, I do expect that there will be some lawyers which will start to turn this into something, because, as we said, artificial intelligence is learning. So if it's learning, then how much responsibility are we giving it? And this is a very good futuristic question, Dr. Sami, because at some point we need to define what legal entity is artificial intelligence.
Yeah, I do agree. Thank you very much.
Thank you for your comments.
Thank you. Do we have any other questions? Please, if you have a question, raise your hand. I see Dr. Sara here had a question, but she
Yes. Hi,
withdrew.
Dr. Sara.
Stanley, wait. Dr. Sara, do you have a question?
First, thank you for the nice meeting. However, I joined late, but I'm happy.
Where are
to
you from,
back.
Dr. Sara?
I'm from Saudi Arabia.
Okay.
You should know me. Me and Sarah only
How do you
female
not know
in this
Dr.
meeting.
Sara?
We are the only female in this meeting. Anyhow, thank you, Sarah, very much for your input and your lecture. My comment was, as Dr. Sarah answered Dr. Sami, it was on the input, because my daughter is studying artificial intelligence, so I knew something about artificial intelligence, and she always telling me that don't trust artificial intelligence. Still, it's learning, as Sarah mentioned, and it depends, as Sarah mentioned, on the information you put, the codes you put in the system. And until now, I'm using artificial intelligence. Until now, I never get disappointing answer from the artificial intelligence. Whenever I ask him a question, he'll reply, "Oh my God, it's a brilliant idea. Oh my God, you are smart." So I think, as Sarah said, it's still learning. يمكن بالعربي إحنا نقول سلاح ذو حدين. We have to be very careful. And yes, Sarah, she answered my question when she replied to Dr. Sami. Thank you very much.
Thank you, Sara, for the comment.
Okay. Do we have one more question? Is this Dr. Kamal Amira? I'm not sure. Yes, please. Stan, again, can you please unmute?
Is it okay?
Yes, Dr. Gamal.
Good evening, everybody, and thank you for your nice talk. I have two questions. One, you mentioned that the sentinel lymph node can be detected by the artificial intelligence. It can detect it without dye, just by the shape or the appearance of the lymph node. And the other question about the dictation. The device or artificial intelligence will see you working and it will transform the work into words steps, or the surgeon dictates inside the operation or describes, and the AI writes what he reads or what he pronounces. What are the answers, please?
Thank you for your questions. Very important. I will start with the last question with regards to the dictation first. So in terms of the dictation, the London group we're working with, it's a validation. So currently it's only audio. So the AI listens to the consultation. So if there's anything you want transcribing that you're not talking, you have to actually say it. So this is in terms of patient consultation. In terms of OR, you're absolutely right. The surgeon will dictate or dictates into a microphone what they're doing. This is a bit more difficult. We found some problems with that because obviously, as you know, as a surgeon, it's, I mean, you're explaining the steps, but there's a lot of kind of, you know, there's your assistant, you're talking to the anesthetist, you're talking to this, to that. So at the moment, it transcribes everything. So, but it's a plain audio function, so it will not see. The next step would be for it to actually record, watch, and then transcribe. But this is the next step of learning, and we're away from that. So currently, it is just an audio function. Dictate. However, the difference between dictating yourself into a microphone is that you don't actually need to use a lot of sentences. For example, when you're during the consultation, you're talking to the patient, you're not actually dictating. It listens to you and transcribes it into a discharge letter or a letter of the, or a report of the consultation. In the OR, it's a bit more problematic. You have to dictate a little bit more, and we're just at the very beginning stages of that. So there's a lot of development. I think there's a lot of trial and error with that still to come. This is regarding your second question. With your first question,
Was
sorry,
the
did I
sentinel
answer
lymph
that?
node, how
Yeah.
it will detect the sentinel lymph node? Is it after dye injection, or just the form or the appearance of the node will say will detect that it is a sentinel node?
Yeah, so also very valid question. So at the moment, it is not detecting anything because at the moment we're still teaching it. So we're just doing the sentinel, we're doing the dye, we're recording the video, and it's analyzing the images. The next step would be for it to actually be able to tell us, yes, I confirm what you're seeing is the sentinel lymph node with the dye. Sometimes if you have more not strongly dyed, the idea is that it would still be able to detect it. And then the third step after that is that it may be able to detect very, very little dye. So you would still have to do the dye injection. This is as far as it will go as an adjunct.
Thank you.
Not without anything. Thank you.
Thanks.
And
Do
I
you
think
have any
Dr.
other
Bassel had a
questions?
comment.
Yes, but
No,
he
no,
raised
no,
now.
no. It was
No
just
more.
Dr. Ala
Hi, Bassel.
Ismail. Hi, Sarah. How are you? How are you, Sham? How are you, everyone?
How are
Dr.
you?
Ala, if you have a question, please
Yes.
go ahead and ask your question.
هو بس بالنسبه لساره ناصر the chat GPT is saying you are brilliant you are blah 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 because هو عارف ان هي بتحب التطبيل ف بيطبل لك يا ساره عشان هو عارف ان انت بتحبي كده ف he's smart enough chat GPT.
And also ChatGPT is trained, صراحة باسل, to always reply. So as long as you write, it will always reply. It will always respond.
Yeah.
And it's also trained for certain sentences. مثلا إذا حدا بيكتب له, for example, I don't know, I feel suicidal or something like that, then it's trained to actually immediately kind of give some help numbers or something like that. So there's certain things that still, you understand that this is still an artificial being. But yes, very
I
valid
think
comment. I'm just showing ideal
artificial intelligence is blessing, and we see it more and more in our work as we go.
Yes, I think somebody, دكتور علاء كان عنده سؤال.
ما
ايوه
دكتور علاء
السلام عليكم.
اتفضل. Yes.
السلام
وعليكم
عليكم.
السلام.
اهلا وسهلا بيكم. ويلكم تو اول. انا طبعا من الناس اللي كنت انترستد في الفتره اللي فاتت بالاي اي واستخدامه في الاوبستيك اند جاينيكولوجي اول اوفر، لكن في عندي يعني كذا concerns about the AI application. أول حاجة first is reproducibility of machine learning of different results in bot. And sometimes you apply, you give him an results for something. It give you how to deal when you apply for this results to another persons or another patients. It doesn't work. I don't know. This is, I think, the problem of AI. The second, in screening problem, the AI needs high resolution cytology cells for analysis. I think we don't have this option, especially in our locality in Middle East. We don't have data set for cytology. As you know, I have a problem for a good cytologist for interpreting cytology results from any part, not cervical cytology only, but any cytology for any disease. I think this is a problem to have a good cytology picture to be analyzed, to have a good results to be interpreted for the patients. And the final one, what about accountability issues in cases of AI error?
Yeah, absolutely, Dr. Ala. This is very, very important. Thank you so much for bringing this up. With regards to high resolution images, you're absolutely right. And this is why I mentioned also that AI needs a very big data set, because حتى مثلا بإيطاليا أو بألمانيا, not every مثلا colposcopy we're doing this, we're teaching, not every image is high resolution. So not every colposcope can provide that. So sometimes, you know, the images come back and say it's not high resolution. The engineers say this is not high resolution enough. So then you have to discard that. And then, so, you know, it is going to be a problem. You need a lot of data for it to learn, because you need these high resolution images. And so if you don't have that, then يلي راح يصير, you're going to have a bias, because
this is a big bias. Yes, this is a big bias.
Yeah, exactly. Because the AI will then only learn from the data, from high resolution data, so just from specific pre-selected centers that can provide it. And so then we're applying AI algorithms that have learned from something that is not maybe adaptable to the region.
Yes.
So I suppose in the future, it will probably be that way, that AI should develop to analyze all types of images, or be not just high resolution, whether it's cytology or whether it's images. But yes, I think we're far from that, and this is very much something, a point that needs to be considered. Absolutely, yes.
Thank you very much. Thank you.
Thank you, Dr. Ala.
Thank you.
Okay, we have one last question.
Assalamu alaikum. Thank you, Dr. Sara, for your very nice presentation, as we used to hear you in your good presentations.
Thank you.
I would like to ask a question. Usually when you have a new innovation, usually there are new disciplines in medicine are being opened. So what is new in medicine after, or in the field of gynecologic oncology after application of AI? ايه اللي قدمه لنا خلانا حاجه جديده ما كناش نقدر نشوفها قبل كده او نعملها قبل كده؟
Very interesting. I think at the moment, AI currently is there to improve speed and precision. So not necessarily something new. This may be in the future, but currently it is being applied to actually just
Make
increase
things easier.
efficiency and increase precision. بس هيدا يعني increase efficiency, increase precision, and increase outreach. مثلا, the idea is, you know, if you have clinics in rural areas, they can send colposcopy pictures, they can be analyzed by an AI, and then they can help the clinicians over there with training and diagnostics and screening. But as such, يعني if you're asking whether it's developing something new, I don't think we're there yet. What could be new is all the prediction models. يعني مثلا to predict whether a patient is going to recur or not, and also personalized treatment plans. I think I would imagine that these could be two areas where if AI develops in them, we would be seeing a lot of advances. For example, predicting response to chemotherapy, predicting response to immunotherapy, etc.
Okay. Any other questions? Anyone has a question? Last chance to ask Dr. Sarah. What I think is that artificial intelligence is here to stay, and whether we want it or not, it will be force itself into our everyday life. And let's see what happens in the next 5 years.
It would be very interesting to see, yes.
Right. Any other questions? Okay, looks like we don't have any more questions. Thank you, Dr. Sara. Always a pleasure having you with us. And please, if you have the time, we can do one in a few months again, if you have interesting topics.
I would be delighted. Thank you very much. It was lovely to be in this group. Thank you so much.
Thank you, everyone, and good night. Good night.
Good night. تصبحوا على خير.
Bye-bye.